Chers amis, chers collègues, bienvenue à la suite de cette série de podcasts sur l'équité en santé dans le cadre de la pandémie de Covid-19. Vous vous souvenez, la semaine passée, on a eu le plaisir d'accueillir une représentante de l'OMS pour donner une vision internationale et on va continuer sur cette ligne. Et on a l'immense plaisir aujourd'hui d'accueillir la docteure Enrichetta Placella de la DDC qui va nous donner sa perspective sur cette pandémie et l'importance de la coopération internationale pour lutter contre les déterminants socio-économiques de la santé. Bienvenue, j'espère que vous aurez beaucoup de plaisir pour la suite de cette série.
Good afternoon, Erica. It's a real pleasure to have you with us today in our Equity in Health and COVID-19 podcast. Erica, you are Deputy Head of Global Program Health at the Swiss Agency for Development and Cooperation. You have previously worked for various medical and public health organizations in Africa, Asia and the Middle East, and you are a member of the WHO Global Coordination Mechanism on Non-Communicable Disease and collaborate closely with the WHO Regional Office for Europe on supporting member states in developing, monitoring, steering, in evaluating NCD strategies and action plans. The COVID-19 pandemic and related global economic and social crisis are a reminder of how interconnected our world has become, and of the importance of cooperation in effectively addressing global public health challenges. It has also highlighted the importance of disparities in health outcomes and access to healthcare, both within and between countries and regions. Erica, could you please, to start this podcast, share your definition of health equity and why it is particularly important to analyze the impact of the current pandemic with an equity lens?
Well, thanks a lot, first of all, for the podcast. And before addressing your question, please allow me to start by highlighting what health equity is not. So when we talk about health equity, we often refer either to a kind of moral posture or to purely economic logics about the costs of inequity. Well, addressing health equity is both. With, of course, the overall goal to advance social justice globally, which is also more than just a moral endeavor, I would say. So equity is about materializing a vision of a society in which everyone, independently from their gender, identity, income, education, etc., has an equal opportunity to live the healthiest life possible. So that will be the basic definition of equity. So health equity is not just about health equality, it's more. And I have here in mind a very simple illustration explaining the fundamental difference. So it's a man, a person feeding different animals with different needs, and it says, so they get the same amount of food, and then it reads, it's fair, everyone gets an equal amount. But so health equity would in this case mean providing food according to someone's specific needs and not the same, the equal amount of food. So smaller animals need less food and bigger animals such as elephants, and you also have dogs here in the picture, so they would need somehow more, so in proportion and based on their specific needs. So now, what does it mean in light of the COVID-19 pandemic? Well, of course, there is a social gradient, and the virus disproportionately affects the poor, especially in countries where access to healthcare is not guaranteed. So at global, but also at the country level, it has further exacerbated, magnified existing inequities. This is why it is important to take an institutionalized approach to addressing the main structural drivers of inequities and exclusion, such as gender, migration, employment, and income. So that's my definition of equity. First of all, what equity is not. And the second approach to equity is an institutionalized, comprehensive approach addressing the underlying conditions of drivers of inequity.
Thank you very much, Erica. I think it's a very good illustration of what health equity means to you. or doesn't mean to you. So that's perfect. Now, beyond within country inequities, are you concerned with inequities between countries and regions in this pandemic?
Yes, of course, we are of course concerned about the inequities between countries which are at the moment more tangible and visible for the access to vaccines against the virus. However, inequities go far beyond the access to vaccines, and this is a very important issue. As already mentioned, COVID-19 is a magnifier of health disparities and their underlying social determinants, which play a major role in low and middle income countries, of course, where access to affordable and quality health services was already a major concern before COVID-19. So this is why the international Coopération COVID-19 agenda we are part of must be equity focused by notably addressing the social determinants of COVID-19 by minimizing the unequal distribution of risks. For example, the exposure to such risks for healthcare workers or caregivers, and effects on public health measures to contain, of course, the pandemic. An equity approach calls for interventions into the social, economic, and political conditions that create inequities. It should also address the inequalities that are perpetuated by health systems themselves. For example, the systemic forms of oppression, such as racism and other bias. So yes, we are concerned. And again, here the answer is an institutionalized, multi-layer approach to which aims at addressing the underlying drivers of inequity within and between countries.
Thank you very much. Very, very convincing. And one of the things you have worked extensively on is non-communicable disease, which is the leading cause of death worldwide, but also an important risk factor for severe complications in COVID-19 patients. So one question is, how is and will the NCD agenda be affected by the pandemic?
Well, as you just pointed out, chronic conditions such as diabetes or hypertension are major risk factors for severe COVID-19 cases. So in addition, I mean, while efforts were and are still focusing on the biomedical response to the pandemic, routine services and functions for monitoring and controlling a risk factor for NCDs have encountered major disruption, and this everywhere, not only in low and middle income countries. So, for example, in the first half of 2020, WHO launched a rapid assessment survey on the impact of the COVID-19 pandemic on NCD's resources and services. Well, the result is, the findings is that, the main finding is that around half of countries reported complete or partial disruption to diabetes and diabetic-related complication management services, with, of course, low and middle-income countries being more likely to report disruption to these services than countries in all other income groups. So this means that the progress made to advance the NCD's agenda globally over the past 2 decades is at risk of being jeopardized by an unprecedented hoarding of resources to respond to the short-term biomedical response to the pandemic. So again, this needs a comprehensive approach to health system strengthening with the integration of communicable and non-communicable diseases prevention and management functions. Now, siloed solutions are not sustainable and are not cost-effective at times of major reshuffle and or scarcity of health financing resources. So there is really a need now to have this integration happen also in order to make major economies of scale.
Thank you, Erika. Very complete answer. Now we go to another orientation for our questions. Maybe it's a tricky question, but how does Switzerland's international cooperation contribute to advance health equity in low and middle income countries using an institutionalized approach?
So, well, again, we are now back to to what a comprehensive approach is. I mean, well, in order to be comprehensive and sustainable, the approach must be, as I said, multi-layered. So first of all, health equity should be fully part of the institutional, strategic, and policy framework. Well, in the case of Switzerland, it brings us back to the preamble of the Swiss federal constitution, which states that the strength of the community is measured by the well-being of its weakest member. So that's at the Swiss level. Then the dispatch to the parliament and the SDC health policy aim both at reducing inequities in all sectors, again, including health. Well, indeed, all programs aim at strengthening integrated, inclusive, and people-centered primary health care for achieving universal health coverage and advancing equity. So that's at the policy level, at the policy framework level. And then secondly, a common ground of understanding about equity at institutional level, again, should be built. Well, in our case, for example, at SDC, there was a confusion between equity and equality. So we embarked, as an institution, in order to clarify concepts and definitions, we embarked in a dedicated institutional learning trajectory in order to get this conceptual clarity. So now we make a huge difference between equality and equity. We use, for example, the concept of equality for gender-related issues, but when it comes to health and drivers of inequity, we use the concept of health equity or health inequity. And then thirdly, understanding political dynamics of equity and inclusion is, of course, key, and it's part of the context analysis. We know that power plays multiple roles in shaping health status, health spending, health regulation, health systems performance. And then another very important factor and step is about identifying drivers and patterns of exclusion, which is also very crucial, being it ethnicity, age, migration, rural, urban, divide, gender, disability, socio-economic status, health literacy, etc. And then there is also a need to define guiding principles for equity-centered approach to health, which can be applied in programs, as well as to establish a set of minimum equity and inclusion-related standards and indicators to really make it happen and to be accountable against those objectives. And finally, of course, we are a state agency. So most of our work is about, and especially at the global level, it's about carrying out a strong pro-equity policy dialogue in UN fora, but also beyond. And then, of course, all these components, they have to be activated concomitantly in order to ensure a comprehensive approach. So each of them is important, but they really have to be implemented at the same time.
Thanks very much. Another point is that equity-related issues are really central in the COVID-19 biomedical response. And a question is how to avoid further exacerbating inequities in the access to safe, efficacious diagnostics, therapies, and vaccines. And what's the role of Switzerland in this regard?
Well, there is, and there will be no trickle-down effect for vaccines. That's for sure. And no one is safe until everyone is safe, as the new adage goes. Everybody has heard about this adage, this new adage. Of course, the virus knows no borders, and so do its variants. I mean, and faster vaccine rollout across the world, including in low and middle income countries again, is therefore critical to stronger and resilient recovery. Now, this is why Switzerland aims to protect its population, but also to contribute to multilateral efforts to increase the equitable access to vaccines, but not only, also to therapies and diagnostics for COVID-19, and of course of public health related measures at the country and at the global level. This is why, I mean, this is the reason Switzerland supports the ACTA-A Accelerated, the ACT Accelerated, which is an unprecedented G20, WHO, and EU global venture with 360 75 million Swiss francs. Well, of course, this is a significant amount compared to other donor countries. And about the half of it goes to Gavi for vaccines in low and middle income countries through the so-called COVAX Advanced Market Commitment Facility, the so-called COVAX ANC. Well, in addition, we also support UNICEF, OIM, and the IFRC to bring the vaccines closer to the population in fragile and or conflict-affected contexts. And finally, Switzerland is also currently exploring the possibilities to donate surplus vaccine doses to the COVAX ANC. So that's basically our approach to the biomedical response. But again, it has equity at the center, and it's also multi-layered. It's not just about the biomedical response, including in the biomedical response, it addresses tests and therapies, and not only vaccines. And then it goes far beyond. It goes also in the direction of strengthening health systems, and beyond health, it also contributes to the response when it comes, for example, to the economic and social consequences of COVID-19. So the entire package should, in the end, really contribute to move forward at country level, but also at global level when it comes to ensure a comprehensive approach. Of course, we are not a big country, so I would say that our comparative advantage is not about the amount, it's about really the way the response is meant to be comprehensive with equity at the core.
Fantastic, Erika. Thank you so much for your excellent answers. It was very clear, very comprehensive, and we also would like to thank you for your energy, for your commitment to this agenda and moving this agenda at the national and international level. So thanks very much again for your availability, your response, and we wish you all the best.
Thank you, Erika.
Thanks a lot. Have a nice day.